Hello there, my lovely. My name's Sarah. I'm a paramedic, okay. I've had a call to say that you're not feeling well, alright. Your neighbour called, okay. So let me just take a little look at what's been going on here. So, okay. Right. So you've not been feeling well for a few days. Yeah, okay. And you've been dizzy, feel a bit feverish, and today you've passed out and hurt your wrist. Okay. Right, just bear with me a second, my lovely. I'm going to get some gloves on and take a little look at you. So how are you feeling right at this minute? Right, okay. Any abdominal pain at all? Okay, headache, nausea. Alright. Okay. So, don't mind me, I'll be tapping a few things into the iPad as I go, okay? It's just to update notes and it goes directly through to the hospital if we need to take you there, alright? Okay, so first things first, I'm going to take your temperature, alright my lovely, let's see what's going on there first, okay? Perfect. I'm just going to pop this inside your ear, alright? Okay, keep nice and still for me my lovely, there we go. Okay, here's some beeps. Okay. Right. Okay. You are running a fever. I'll just pop that in there. Okay. Your temperature's 38.2. Have you taken any paracetamol or anything to help bring the fever down today? No. Okay. All right. So you've passed out and you've hurt your wrist. I can see you've got an ice pad on your wrist. These ice packs are really useful, aren't they? Okay, let me just remove that. Take a little look. Alright, yeah, okay. I'll have another look at that shortly. Okay, it does look like it could be broken. Alright, let me just pop that back on. Yeah. Very gently. There we go. Okay. I'm going to just pop this onto your finger, alright, just so I can check your pulse and oxygen sats, okay. Have you been having trouble breathing at all? You felt a little bit wheezy. Alright, okay. Just pop that, I'll pop it onto your good hand because I don't want to move the fingers on this hand. Okay, there we go. Alright, only takes a second. I'm sorry we took a while to get here. We're very, very busy and the roads are just so bad today. Okay, right. So your oxygen sats are at 95, a little bit below where we'd like them really. Okay. Your pulse is a little bit elevated, but I'm not too worried right now about that. Okay. Alright then. So, let me have a little listen of your chest. I think we need to do that. Okay. Alright. Tell me if you feel dizzy at any point, won't you, my lovely? Okay. I'm just going to place this on your chest. Alright? Okay, warm it up a little bit first. But you're warm enough, aren't you, with your fever? Okay. So just take a nice breath in for me, my lovely. In and out. Okay. And again. In and out. And in Just breathe normally now for me. Okay, could you give just a little cough? Okay. I'm just going to pop this round the back a little, okay? Just breathe in for me and out. Okay. And again. In and out. Okay. And around this side. In and out. And in and out. Okay. Alright. Just going to pop this onto your neck. Alright, there we go. Breathe normally for me, my lovely, thank you. Okay. Alright, okay. You're feeling dizzy after that? A little? Okay. There is definitely a bit of wheeze and crackle. Have you had a cold recently? No. But you just had this fever feeling and the chest not feeling good and dizzy. Okay. Sore throat? Okay. Okay. Right. I'm going to check your blood pressure, alright? Very important, particularly if you've been feeling faint, alright? So I'm just going to pop this cuff around your arm, alright? It will go a little bit tight and uncomfortable. Okay. Pop my stethoscope just on that artery there. There we go. Okay. And I'm just going to inflate the cuff, alright? Okay. Okay. Are you okay if I do that again? Okay. Okay. Do you mind if I checked it on your other arm? I'll try not to move this arm because I know it's painful. Okay, but I do want to make the comparison. Okay, there we go. There we go. Let's gently pop that there. Alright, pop the stethoscope on. Okay, there we go again. Tell me if this is hurting you, won't you? Okay. Alright, let's pop this down there. Take those out. Right, your blood pressure is rather on the low side, okay. It's coming out at 85 over 55. That's really, really low. Okay. So, let me just update this here. Okay. Alright, there we go. So I'm going to take a little look in your eyes, if that's all right, okay, just to see how your eyes are reacting. Tell me if it's uncomfortable for you or it's triggering any headaches, unusual sensations or any dizziness, okay? Right, here we go. Just look straight there for me, my lovely, okay? Perfect. Okay. Okay. Now could you just follow the light for me as I move it from side to side? Okay. And up and down. Okay. Alright, that's fine. Okay. Let me just update that a second. Okay. Let's just check what's going on underneath this pad. These are so good. Okay. Can you give your fingers a wiggle for me? Does that hurt? Okay. Alright, I'm just going to press very gently. Oh, I'm sorry. That's got a lot of bruising. Yeah, okay. I'll keep this ice pack on it. Keep a check on it anyway. Okay, perfect. Right, because you've had a fall, I want to just check your head, okay? Just have a little press around your body and have a look down your ears to make sure that there's no bleeding from the eardrums. Okay, are you hearing me okay at the moment? Alright, if you move your eyes, does it make you feel more dizzy? A little bit, okay. Have you got any fullness in your ears? Okay, a little. Alright, okay. So I'm just going to begin by just pressing just around your head. Does anything hurt there? No. I can't see any lacerations to your face. Okay, just press around. Okay, I'm just going to have a move around your face. Okay. Alright, anything hurt across your shoulders? Okay, what about down your arms? We know this one is potentially broken at the wrist, so I'm not going to press down there. Does that feel okay? I have a little bit of bruising on this arm, but I guess that's from your fall. Okay. Anywhere across the abdomen sore? No? Okay. And down to your hips here. Okay. And legs. Okay. Okay. Can you give your toes a wiggle at all? Okay, painful? No. Okay. Can you wiggle your fingers on this hand for me? Okay. Alright. Okay. Are you feeling dizzy at the moment? Okay. Have you had any double vision? Right. Okay. So, I'm going to take a little look inside your ears. I'm going to use this otoscope here, okay? I've just put a new tip on it and just have a little quick look just to make sure there's no bleeding or any discharge from your eardrum. Okay, alright, just keep nice and still for me. Okay, perfect. Lovely. Everything looks fine. Okay, just withdraw that. Okay there, alright. Just a little look on this side. Just a little look. Okay, everything looks fine there too. Everything looks fine there. Okay, perfect. Right, I've got a few more checks to do, but would you like me to get you something for the pain? Right, okay. Just relax there a minute and I'll just get that fixed for you. Okay. Okay then, my lovely. So how are you doing? Holding up there, okay, right. What I'm going to do for you is just give you an injectable form of paracetamol, okay? I think we're going to have to take you to hospital because you have got very low blood pressure. You've obviously had a fall. Your wrist looks like it could be broken. Okay, you're running a fever, so we need to find out what's going on here. Yeah, I suspect you have got some kind of infection, especially with your chest sounding a bit raspy, wheezy. Okay, a couple of crackles there, and I want to get you thoroughly checked out by a doctor there. Okay, so just going to give you a little injection. I'll pop it into this arm because I know this one's already hurting. Okay, I'm just going to give your arm a wipe first. Okay. Okay, get the wipe there. Just give that a nice wipe. There we go. Right. We'll just get a sharp scratch now. Okay. You ready? Okay, sharp scratch. There we go. That's perfect. Wonderful. Didn't hurt, did it? Not much. Okay. Just jot that down. Okay. All right. And I don't really want to inflict any more pain on you, but I just want to check your glucose, okay, to make sure your sugar levels in your blood are normal. Okay, I've not got any notes to say that you're diabetic, no, and that you're not on any other medication, are you? That's perfect. I can't see anything on the notes that would give me any cause for concern. So I'm just going to prick the end of your finger and we can just check the glucose level. All right? Okay, I just need to just break this off. There we go. It's a very, very tiny, tiny needle. Okay, so let's just get another wipe there. Very quickly. 1, 2, 3. There we go. Great. Just got to collect that there. Okay. Right, there we go. Just hold that on there for a little moment. There we go. Right, just pop that there. Okay. That'll tell me your glucose. Okay, that's absolutely fine. Your glucose is 4.1, that's perfectly fine. You have eaten today, a little bit, okay. Don't always feel like eating when you're not well. Okay, just very unfortunate that you've passed out and now potentially broken your wrist on top of feeling poorly. Bless you. Okay, so let me just have another little check of this wrist. Alright then, let's just tidy away some of my mess. Just going to check your oxygen sats one more time. Okay. Yeah, they're still a little bit low there. Okay. Alright. Perfect. Let's get that sorted. We'll get you on your merry way soon. Okay. So I just want to do a little neuro test. Alright. So what I've got is a needle, but it's not a sharp needle, as in the needle that I would use for injecting you. It's got more of a blunt end, okay? But you'll feel it as sharp on your skin. Okay. So I want you to close your eyes for me and just tell me if you feel sharp now. Okay. Yeah. Okay. Just tell me when you can feel something sharp. Okay. 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 All right. Okay. can you feel now? Soft, okay. Sharp, okay. Okay, alright. That's fine, not got any concerns there about that. Okay, now I would normally do this test on both sides, but obviously we're going to leave that hand alone. So with your left hand, can you just grip my hand here? Okay, I'm going to pull you. Can you push me away? Okay, push, 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 push. Okay, okay, that's good. Okay, I'm going to push against you and now push me. Okay, so now pull me towards you. Okay, let's check these things. Okay, that's got some good strength there. That's fine. You can feel that fine. Okay, just going to put my hands on your shoulders. Okay, you just push up for me. Okay, that's fine. Okay, let me just check that hand. Okay, that's fine. Okay, so you say you haven't got any hearing problems? No. Okay. Right. So how are you feeling at the moment? We've got to give the injection a little time to work. Yeah. Okay. All right. Well, I've sent a message for my colleague to come in and we'll get you off to the hospital. Okay. I know nobody really wants to go in, but I really think we need to take you in. Okay. Given that your obs aren't the best, to be honest, and you are running that fever and your wrist is underneath here getting bigger by the second. I mean, I think the ice is really helping, but I think there's definitely a fracture there. Yeah. Yeah. Okay. So I just want you to lie there and relax. Okay. Just keep breathing nice and steadily for me and we'll get you off to hospital. All right. I think your neighbour's been very kind and got a little bag together for you. All right. Yeah. Is there anybody that you need us to call? Yeah, we can do that, no problem. Okay. So just relax and my friend will be in a second. She'll be coming in to assist. We're a great team. We're not only colleagues, but we're really good friends as well, so it's really good. It's nice when we get to work together. Yeah. Right. Okay then. So let's get you off to hospital and get you checked out, my lovely. All right? I'm sure we'll have you right as rain soon. Okay, just relax.